Thanks so much, William, for the invitation, for inviting WHO to this very important discussion. Seafarers are really unsung heroes, and they have been grappling with this COVID-19 pandemic in an effort to continue to deliver the essential goods, medical supply, and to ship them all over the world. So we are truly thankful to their sacrifice and also the commitment to this to ensure the sustainability of the essential supply chain. So we're very happy to join this global voice and to support the resolution of climate change crisis. We know this is a long journey, but we're really happy to contribute to the global initiative and regional initiatives as well. So just talking about our work on this related to the international travel and transport and the points of entry. So we have been issuing and recommending the national governments on their approaches for dealing with the resumption of the international travel, reopening borders, and so on and so forth. For each international, the global guidance, we always emphasize the importance of prioritizing the essential workers, including the emergency responders, and also the travel and transport workers, for instance, seafarers, and also the cargo transport. So in the recent global guidance consideration for a risk-based approach for the international travel in the context of COVID-19, we reiterated this principle, which is really to recommend that all the countries that the public health authorities and to support the governments to identify and also the prioritizing again the essential workers, and seafarers is among that group. And we want them to understand they need to facilitate the international travel and to keep the essential supply chain operationing. So this guidance was published on 16th of December. We are happy to share with you and share with all the participants afterwards. We also have been joining hands with our partners, IMO and ILO, since the start of the pandemic. So we issued a joint statement in April with IMO and ILO, and to call upon the governments also to facilitate the access of medical care of the seafarers, and also to keep the sanitary conditions on board the ships. So to ensure that the public health conditions for the seafarers are fully safeguarded. And in meanwhile, we also worked together with IMO, ILO, ICS, and Guy was very active part of that. We're working on the guidance for promoting the public health measures on board the cargo ships and also the fishing vessels. So that was also published in July, and we also together with this guidance, we also published our training programs, which IMO has shared, disseminated through their network. So I hope that guidance will also supporting the shipping industry to promote their health standards and health requirements during this crisis. And the other thing I wanted to emphasize is WHO, as the Secretariat of the International Health Regulations, which is a health instrument that 196 state parties have signed up for. And we are monitoring the restrictive measures implemented by the country, for instance, the border closure. And so they have to provide the IHR secretary the rationale of doing that, why they're doing that, based on what type of risk assessment. And in the current the guidance, global guidance I just mentioned that was published on 16th of December, we recommended the governments to take a risk-based approach to decide on the border health measures instead of taking a very drastic decision on travel and trade restriction, for instance, closing the borders. So we recommend that basically the authorities, they need to do the risk assessment before decision on any cross-border risk mitigation measures. So so on that, we have been monitoring, and also we continue to advise the countries and the health authorities in the countries the importance of keeping essential supply chain moving, and to identify the seafarers as key workers. So we have our Assistant Director General who joined the International Maritime Day 2 or 3 months ago. And during the workshop, he basically reaffirmed WHO's continued engagement with the partners to provide technical support for the maritime sector, so they can be supported in the technical level on how to address the challenges during the pandemic and how to enhance the resilience during the pandemic of this sector. So we recently, last week, we actually worked again with IMO and ILO, and we identified a WHO country office in a Pacific Island country because they have been doing really great job in trying to help repatriate the stranded seafarers. So they worked with the partners, the maritime and the IMO and ILO, the local representatives, and they provided the testing laboratory access. They provided the PPE, and they provided the preparation of isolation and quarantine facilities, and trying to support the repatriation of stranded seafarers. So we used this story and published in a weekly operational updates, which is basically disseminated to all the WHO country offices and also the partners and the national governments, and to use that story to exemplify that actually during this crisis, WHO, our offices in the local level can play an important role to work with the partners and to support resolution of this crisis. So I can share with that the link also, because we wanted to also, this voice of seafarers can be heard by the governments, and through this joint dissemination of these messages and also continuing advocacy through the UN agencies to the governments. So the last but not the least, I try to also stress on the importance of this multi-sector work, and I think that our previous speakers have already touched upon the importance of this all of society, all of government approach. We have the international health regulations, which mandates countries for each point of entry, they have to establish the public health emergency preparedness plan, which is a multi-sectoral action plan. And that includes all the identification of case management, isolation, quarantine, facility and service, and the communication between the different partners and also with the health authorities. So this always is what the lessons learned we have from the past outbreaks is that we all understand the importance of this multi-sectoral work. But only when the outbreaks hits us, we started to realize actually we should do better when we are in the peacetime. We can do the simulation exercise and to see what are the vulnerabilities in this plan, what can work, what cannot work. So of course, this is a little bit hindsight, but I think it's also a lesson learned for the next outbreak, because I think that many crises will continue to recur. And in the future outbreaks, if we never learn, we would never have a preparedness plan. So with this, and I wanted to again to show our a great appreciation of IMO colleagues to organize this webinar and to raise the voice and to shout out that how important we need to join the forces and to support the resolution of this crisis change, and will remain our engagement towards this initiative. Thank you. Over to you.